As confusion abounds in the private insurance marketplace, some people are turning their attention to direct primary care. We'll talk about what that is and some of the consequences today. I'm Brynne of ABC for Health. We're talking about a medical practice that charges patients a flat fee instead of billing insurance in a fee-for-service manner. So this could be a monthly fee, a quarterly, or a yearly fee that covers any clinical, laboratory, consultative services that patient might come in with. It does not include emergency services. So it'd be paying $20, $50, $100 a month and being eligible to see your primary care physician, the one that has this arrangement with you, for whatever needs might come up. It is an alternative to fee-for-service billing. It leaves the insurance company completely out of the picture, but it is not insurance. It means that if there is a medical emergency, you will be charged the full cost of that service because you would be then going outside of your primary care. It does not include specialty care, and you could see the big bill from that. Many physicians that have started the direct primary care relationship in their offices have encouraged patients to get wraparound coverage, some traditional plan. They sometimes recommend a high deductible plan just in case of emergencies, should that need arise. Now, this you might not have heard of for a while, but it might sound vaguely familiar from the past. It was gaining traction before the Affordable Care Act was passed. The Affordable Care Act and its individual mandate then had people going toward traditional insurance and the marketplace for coverage to avoid the penalty for not having insurance. Having a direct primary care relationship where you are paying fees does not count as qualifying health insurance, and you would be subject to the penalty for being uninsured if that was your only arrangement for paying for care. Now, it is making a small comeback in areas with high uninsurance, and a lot of attention lately has been focused on the state of Texas, where a lot of primary care providers have gone back to this direct primary care model where patients are paying just an office visit fee for some of those clinical or office visits, that small check-in from time to time. Now, some argue this is better than nothing, but the patients that have experienced those large bills, medical debt, or uncompensated care would argue otherwise, that it did not cover the services they needed when they needed it. It was good for that quick check-in, but nothing beyond that. Now, others argue this is not a model that follows that concept of a patient-centered medical home. You would perhaps have a relationship with that one primary care provider, that direct primary care provider, but not a healthcare team. And the concept of a medical home is so important, especially if you're working with children, where the whole team is involved with the care and the continuity of care between the relationship between the primary care provider, the specialty services, the parents in the home or caretaker relatives, and the patient or child themselves. So that medical home model gets lost in this conversation. Now, again, this is not something that is recommended for those that are on Medicaid. Medicaid patients should not be paying a direct primary care fee. In fact, a direct primary care provider that accepts a fee from a Medicaid patient would have to worry about Medicaid fraud consequences and billing, the penalty for billing a Medicaid patient. Now, direct primary care membership fees cannot be paid out of health savings accounts or flex spending accounts, and Medicare savings accounts certainly won't pay them as well. So that has other people a little concerned that Medicaid and Medicare patients might not know their rights, and folks that participate in flex spending accounts might not know as well that that is not a covered service. Now, you can read a little bit more on this direct primary care model, especially how it's playing out in the state of Texas. We shared that Kaiser Health News article that looked into that in more detail. There's also another article that gives us a little bit more detail on the direct primary care is not an insurance policy. It looks in a little bit more detail of what that actually means and the consequences people have run into. Is it better than nothing? You can let us know. Keep your finger on the pulse and stay in the conversation with us and share your thoughts on this direct primary care model. You can send us an email, ask us a question, or tell us your healthcare story at healthwatchwisconsin.org. Thanks for joining us.